Hey, welcome to Body Doc. So there's probably none of you out there that hasn't had somebody walk up behind you and grab those muscles at the base of your neck and start to dig in, and you just sort of melt and you're like, oh my God, I wish somebody could do that to me all day long. So this video today, we're going to be talking about what probably is the reason behind you guys wanting somebody to do that to you, why I spend kind of countless hours in my office here doing that to people professionally, of course. You know, I'd like to think that I can do it a little bit better than your friends can, or the Theracane, or all the different devices that are out there. But we are going to talk about lower neck patterns today. I've got them basically broken down into three primary patterns. The localized pattern is the one where really all you're feeling is pain right there at the bottom of your neck, as your neck is sort of becoming your thoracic spine, and you see the upper trapezius muscle, which shapes here. So the muscle that would sit right in here that creates that shape. And that knot sitting there right at the base of your neck and those upper back muscles. That's the most common thing that people come in with. That could be a really burning, searing pain. Oftentimes, if you're sitting at your computer for a long period of time. We've got the anterior head carriage, which is the Vladimir Janda video that I have. You've got this sort of mechanical load where the head is lying forward and it's putting so much demand on these muscles that they just simply, become sort of filled with lactate, is the theory, trigger point development, and you have a localized myofascial pain syndrome of the lower neck area. Okay, and that localized entity can also come from spinal origin. I have your localized referral. So imagine that the bones in your spine, the actual vertebrae, have degenerative changes in them. They can often lead, even in the absence of anterior head carriage, or the absence of maybe sitting at your computer or being really stressed out, which I should have mentioned a little bit earlier, stress being a major component of the onness, if you will, of those muscles. It seems like, I know when I'm sitting trying to do video editing or trying to do something new on a computer, I've noticed in my own body that burning effect can build. Whereas if I'm just sitting there and surfing the web or watching an interesting video and I'm being entertained, like you are right now, I don't get that. So there's no doubt there's a little bit of mind-body with this one, as far as maybe how the synapses are hypersensitized when our brains are being challenged, or when we're watching something that's disturbing. So we've got two entities to summarize that. We've got myofascial pain, which is more often caused by just a mechanical load, and that's muscles and fascia being your pain generator. We've got another entity where the bones deep in the spine can refer out, giving a very similar pain presentation, pain in the same spot. They both feel great to have it worked on. Maybe in the case of the spine being your pain generator, or the real true origin of your problem, you might want to take your head forward, have somebody do a little Schulman on you, which is to have the head forward in a way, digging through those muscles while we're also taking the load off the bones, and that way you would achieve it. Cervical traction is a really nice force to apply this as well. Something that I do a lot with my patients is I'll try to determine, hey, am I dealing with myofascial, or am I dealing with a pain that's coming from the bones that feels or looks myofascial? I'll often lie them on my table face up, and I'll grab their head and I'll do some cervical traction. And what I would look to find is somebody saying, oh my God, I wish you could do that all day. As opposed to where I pull on the head, I do the traction load, I'm taking the bones apart and I'm decompressing them, and the patient is feeling no different. That's the way I've been kind of sort of ruling in and out whether or not I've got somebody that's dealing with bone pain referring there, or myofascial pain referring there. And that's the spinal and the localized referral from the spine. Then we have a whole host of other problems that go a little bit deeper, a little bit more, and I have here distal referral. So now I've got pain in my neck and I want somebody to come in and I want them to grab me and I want to dig. But when they do, I'm feeling a referral down my arm, sometimes into my shoulder area, sometimes into my chest area, sometimes all the way down to my hand. This one's a little bit more difficult, but you actually can rule these things in and out. There's a great test called maximal foraminal compression. So what I would do to find out if somebody has a myofascial, a localized entity that's referring way down, they do exist. So the spine is the bone. this localized myofascial problem, if I press on a trigger point, maybe like in the infraspinatus muscle of my shoulder blade or in that upper trapezius muscle there at the base, can actually refer all the way down the hand. Really interesting. A pseudo neuropathy. They're not a real true nerve irritation, but they act like one. And that's a nice one. You almost always want to treat that anyway, as far as the way I go about this. If I find somebody's got a true new nerve root irritation, so I can do a maximal foraminal compression. I can take somebody's head, turn it, close the hole where the nerve exits, push down, and set off a referral. I'm almost certain to be dealing with a nerve root irritation or a nervous system with a distal referral. In the absence of that, and that test is negative, I can come back up and I can just keep their head in a nice neutral position, not encouraging any nerve irritations, but simply just try to rule that out by pressing in on trigger points around the neck area. If I can get that to refer down an arm, I know I've got a myofascial referral point or trigger point. It's oftentimes, again, in my clinical experience here over the last 25 to 30 years, I've found that even in the absence of a test is negative and I'm probably pressing down on the muscles and the fascia and maybe influencing in some small degree the nervous system. I often find this sort of like those sort of subclinical nerve irritations with this particular pattern. So you see this quite a bit. The famous one though that almost all of you are going to be looking at though is the levator scapula pattern. The levator scapula muscle starts at your transverse process of C2, C3. It drapes on down, twists a little bit, and plugs into the top of your shoulder blade, so right over here. And that's another great one where you'd want somebody to dig their fingers into. That's the insertion point for levator scapula. Probably the most common link between an upper pattern and a lower pattern, but it's quite often found where the treatment is in the lower neck area related to the making of this video. So you've got your basic bone, myofascial, and nerve. They're all capable of being pain generators, causing pain in the lower neck area. But it's nice to rule one more in and out because you're going to be a lot more effective in treating it if you know where your pain generator is and which structure is actually causing the reason for you having that nagging pain in your upper back or in your lower neck, okay? I hope this helps you to understand a little bit of the pain generators, the differences in patterns between a localized pattern and a referral pattern that's now going down the arm. Again, the more you know, the less you're going to guess at this stuff. Keep on learning, keep on coming back to the videos, cross-correlated with some of the other ones here on my YouTube channel. Take care.